Do painkillers like ibuprofen, naproxen, or commonly called NSAIDs affect the heart health? Yes, these painkillers do affect the heart health in an adverse fashion. There is an imbalance of thromboxane as well as prostacyclin, and this can increase platelet aggregation and clotting activity in the body, which can cause chest pain as well as heart attack. Hi friends, today we will talk about a very common question that my patients ask me all the time in the clinic. Do painkillers like ibuprofen, naproxen, or commonly called NSAIDs affect the heart health? So my friends, yes, these painkillers do affect the heart health in an adverse fashion. Why is that? The painkillers cause elevation of blood pressure and they may increase the risk. The painkillers cause high blood pressure. They can also cause salt retention, which is followed by water retention, and they can also worsen platelet aggregation in the body. And all of these can cause chest pain, heart attacks, elevated blood pressure, as well as a stroke. Let's understand the mechanism in a little bit more detail. So the NSAIDs primarily block COX-1 and COX-2 enzymes in our body. The COX-1 enzyme is usually working to produce thromboxane, which further causes platelet aggregation in our body. And the COX-2 enzyme works to produce prostacyclins in our body that help to dilate the blood vessels. Now, when both of these enzymes are inhibited by the blood thinners, there is an imbalance of thromboxane as well as prostacyclin, and this can increase platelet aggregation and clotting activity in the body, which can cause chest pain as well as heart attack. Because of the decrease in prostacyclin, the enzyme that dilates the blood vessels, the blood pressure can also be elevated, and high blood pressure can also contribute towards chest pain, heart attack, and stroke. There is another separate mechanism by which the NSAIDs also cause high blood pressure, and that is by affecting the kidneys. The vasoconstriction caused in the kidneys causes salt retention as well as water retention in our body. And because of salt and water retention, in addition to the vasospasm caused by the prostacyclin inhibition, altogether this can raise the blood pressure very high and again lead to these adverse effects. So my friends, most importantly, if you do have a cardiac condition like blockages in your heart or heart failure or uncontrolled blood pressure or a history of stroke, then you should be very cautious using these over-the-counter medications. Now, when can you use them and how can you use them? Let's say you have an injury and you have a heart condition or a prior stroke. Then you should go for the lowest dose that is possible and for the shortest duration that is possible. Usually, if you use these medications for few days to few weeks, less than a month, then the chances of heart attack or stroke are less. But these adverse effects build up over time in our body. And so taking these NSAIDs for a very long period of time in months can definitely cause these adverse effects. The other thing is you should try alternative therapies as well, like hot or cold sponges, like using Tylenol or acetaminophen in high dose, which can have a significant pain relief effect without causing these adverse effects that the NSAIDs cause. So my friends, if you have any heart condition and you need painkillers, it is very important that you talk to your cardiologist and understand the duration and the dose that is safe for you when taking these medications, and to identify if there are any other alternatives that might be better suited for you in the long run. I hope that this discussion was helpful, and if you have any questions for me regarding cardiology, please feel free to comment. Thank you.